Welcome to Breaking the Cycle of Poverty, featuring Jay Height, Executive Director of Shepherd Community Center in Indianapolis. My name is Tim Swearens, and I'm your host for these conversations that explore why poverty remains such a persistent problem in the United States. On this episode, Jay discusses meeting neighbors' healthcare needs with Dr. Daniel O'Donnell, the head of Indianapolis's Emergency Medical Services, and Shane Hardwick, a paramedic who is a key member of Shepherd's Shalom Project. Jay, tell us about this conversation that you had with Dr. O'Donnell and with Shane.
Yeah, for 10 years, we've had the Shalom Project, and it was birthed out of this unique partnership of Shepherd, IMPD, and IEMS. That is all the medic, ambulance crews, and EMTs. And so we sit down to have a conversation, sort of a look back, trying to understand the life of a first responder in our city, how this partnership is working, and really where are we going. And so we get an opportunity to listen now to that conversation.
All right, let's dive in.
Hi, I'm excited today to be with two friends, Dr. Dan O'Donnell, head of IEMS, and paramedic Shane Hardwick, who's part of the team here at Shepherd Community. First, for our viewers, what does IEMS stand for?
IEMS stands for Indianapolis Emergency Medical Services, and we are the number one provider of 911 EMS, so the ambulances, your paramedics and your EMTs, your lifesavers that are going and answering over 130,000 calls a year here in Marion County.
And we're privileged to host one on our site where we provide you the ability, a crew room. And how busy would an ambulance be on in our neighborhood?
Right. I mean, I wouldn't be surprised if some in your congregation say, "Well, I see that ambulance, but I don't see it during the day." And I think we are busy. We're very, very busy. I think on a typical shift, which is 12 hours for a paramedic and EMT team or an EMT team, they're going to go on anywhere from 8 to sometimes 14, 15, 16 runs in that 12-hour period. So again, a run is from the time the 911 call happens, they're dispatched, they take care of the patient on scene, do what's needed, take them to the hospital. So again, we're running. So again, our ambulances and our providers are extremely busy. But again, they take pride in that. That's something they're very proud of, is how busy they are, how good they are, and how well they're able to act in such a busy urban environment.
Well, we're glad to be able to partner and be able to provide that. Shane, you have been a part of what we call the Shalom Project for about 10 years. Tell us a little bit about what that means.
Sure. So the Shalom Project kind of looks beyond the immediate need. So the 911 call takes place, and I think everybody knows, like, sirens are kind of the song of the city. And there's all these sirens, and they're going everywhere. And, it's that immediate, in-the-moment response of things that have been going on for days, weeks, months, sometimes years. And so what we don't want to do with the Shalom Project is just kind of rinse and repeat. Like, we're going to pick you up, take you to the hospital, we'll see you again next week, which there are those relationships within EMS crews and patients. Our job is to go beyond that. Our job is to look at patterns of life or just dig in deeper into why a patient calls 911. And the best way to do that, the absolute best way to do that, is through a relationship. And so we try to identify patients that are using 911 system, like the 911 system, a lot, and trying to, like, build that relationship that ultimately slows down the 911 dependency. Because kind of the elevator pitch that we give is that overuse of 911 is a symptom of an unmet need, that they're just not getting in the average encounter with emergency medicine or law enforcement or what have you in that space. So we just try to get to know the patient and know them on a first name basis and just say, okay, how can we help you stay healthy? How can we keep you out of that ambulance?
So a key understanding, because people will say, well, how do I get one of these for my neighborhood, right, is that Shepherd is paying for Shane's time. We also employ an IMPD sergeant who, together with the team, are out there. So what's a typical day like, Shane?
So the mornings are usually kind of that calm time, to where, we can kind of dig into the computer and figure out, like, okay, where do we want our day to take us? And to just kind of get our head around, what needs are out there. What have we encountered recently? Bill called last week. Let's go see if he got his medications filled at the pharmacy or what have you. And then as the day goes on, some days, we can stay right on task, and there's other days that emergency calls kind of interrupt, and we have to divert, and we kind of have to prioritize those non-emergent engagements to things that are like immediate and they're happening right now. And so we always end up circling back to the original plan, but for my ADHD, it works out really well that we're kind of all over the map. And it's, some days we've worked through people's like, well, you need a wax ring for that toilet. That's the big problem, all the way up to, critically injured patients that need, or critical incidents with law enforcement that, it needs to happen right now. So we're kind of all over the map, and that's kind of, I can tell you how the day starts. How it ends is typically anyone's guess, because it's just there's a wide variety of people and situations that we encounter.
Yeah, it's a unique partnership, putting a police officer and a paramedic in the same vehicle to go. We talk a lot about that poverty takes away your ability to advocate and navigate. Mm-hmm. And so 911 tends to be the way they navigate, but that's an expensive option, and we want to create other options. What I'm really excited about is this has birthed something new, where this replication of what we are trying to do. Doc, you want to talk a little bit about what we're doing with IEMS in other parts of this community?
Sure. Again, and on top of what Shane's doing is we wanted to take the model that you all have, we never say perfected, but have certainly done an amazing job at developing, and taking the lessons learned and expanding across Marion County, offering those services to other areas in Marion County, really targeting the people who, first seem to be at risk. So that it's identified by our paramedics, by our colleagues in the fire department, police department, and others, that people that may need that extra touch, that other extra medical person to come in, take the extra time to figure out what's going on, what are the barriers to them getting the health care that they need. So we actually have expanded this. We have 2 additional providers, and we're looking to bring on a 4th, so we can actually get around all of Marion County and provide the service and be proactive in people's health care.
And so what we're working with is we provide an MSW who's helping, and we use MSW students, Masters of Social Work, where they're getting real life experience and helping these folks, these patients, be able to navigate and find the resources. It's a challenge, and we know that if we can reduce the number of 911 calls, that saves the city money, but not only that, it allows you to really focus on the calls that's necessary. On a typical medical run, you're going to have an ambulance, maybe a fire truck, police officer. That's a very expensive use, and also we're saving taxpayer money by being able to help them. Doc, in the world of IEMS, in the world of emergency medical services, there's lots of TV programs, right? I'm old enough to remember Squad 51. And what's the challenges that you're facing in today's world? Times are different. What is it that maybe folks don't know that's a challenge that you're facing in medical services?
There's many. Again, we only have so much time to dive into it. But as far as emergency medical services, I think the biggest challenge, or maybe the biggest change we've seen, is a couple. One is the medical system, unfortunately, is shrinking. Again, the access, and it doesn't take much for somebody to try to attempt to establish with a primary care physician or try to get in with a primary care physician. That network is shrinking for a multitude of reasons. We can talk about it another time. So that leaves people with, what do I do? What do I do when I'm sick? Again, I think old is people always thought, well, 911 is just used for the major things, major trauma, heart attacks, strokes, everything in between. But I think where it's changed over the last 20, 30 years is people are now relying on 911 when they're in need. And that need, as with regards to medical services, can be anything. I'm sick. My child is throwing up. I don't know where else to go. I'm going to call 911. And right now, in today's construct, in today's world, 911 means an ambulance and maybe other apparatus out there. So it's really changed. Again, and we're doing all that additional work and response in the setting of violence continues to grow. Obviously, people are still having heart attacks each and every day, strokes and everything else in between. So we, as an EMS service, our biggest challenge is being able to meet that increased need for medical services, not necessarily always emergency medical services, certainly a medical need to the patient, but also balancing that with the growing number of calls for emergencies, what we would all traditionally think of emergencies. So that's been our biggest challenge. And programs like what we have here at Shepherd goes a long way in helping us find that balance.
Well, I know, I'm sorry, you know how much we respect what you do and what Shane and all of your paramedics and your EMTs do, true heroes for our communities. Yes. What can, as a community, what are ways that we can support IEMS and the great folks and the heroes that serve each and every day?
I think first recognize them. Again, EMS is its own standalone profession. I think, and it's not, you reference old TV shows, things like that. I think a lot of people traditionally think, I'm going to call and here comes the fire department. And there seems to be these big white boxes that fall behind the fire department. EMS, emergency medical services, our paramedics, our EMTs are specially trained personnel who can provide high-level medical care in very, very non-traditional settings. I'm an emergency physician by trade. I work at Eskenazi Hospital, which I love, but I'm in a very comfortable spot. It's temperature controlled. The lights generally work. People are, in a bed where I can take care of them. That's my comfort zone. Our EMS providers, our paramedics and EMTs, are providing this high level of care, not too different than what I'm doing in an ER, on the sidewalk, in the snow, in the rain, at times when it's told it's not safe to go in that area. So again, first, what you can do to support them is just recognize them. Thank you. Thank you to the paramedics. Thank you to the EMS, the EMTs that are out there. Respect. I know it's difficult. When we call 911, especially if it's for a loved one, emotions are high. And our folks are there to perform a specific duty, and that is to take care of that patient, whether it's a stranger that you just called 911 for, or it's a loved one. It's, your husband, wife, son, daughter, whoever, is allow us that space to work. Again, provide us the information that we ask, but realize we're there to help care. We are we're not here to get anybody in trouble. We're not here to create any kind of increased tension. We're here to help maybe relieve the tension. So give us that space to work and give us, be forthright with the necessary information so we can take care of your loved one or whoever may be there. And I think those are the big things. Again, I think that's what if I had a microphone, which I do right now, that's what I would ask of folks.
Yeah, I had lunch with Officer Perkins and I were having lunch today, and this guy walks up and he says, "I want to thank you for your service." And I go, "Well, thank you." And he goes, "Oh yeah, you too."
Yeah, and I think we see that, and exactly, and I my own mom, she when I first went in the world of EMS, she says, "Oh, like the fire department." I said, "No, this is completely different." But again, these are, it's. I can just speak as the chief of the service. It's incredibly fulfilling to serve such a passionate group of medical pre-hospital professionals.
Yeah, we get a little glimpse because outside my office, I can see the ambulance coming and going, and it's busy. And we are thankful that you're there. Now, Shane is not trying to do a Minion lookalike there with his outfit, but what's the real reason why you've gone to those fluorescent?
It's safety, and this is a big change. Is we realize EMS is an outdoor job. And historically, and I guess what's required nationally is that you make sure you're doing everything as safe as possible. But what we realize is that IEMS and EMS is we are outdoor all the time, and therefore it puts us at risk. We are in streets. Even if we're going to respond to a house, we have to park, we have to get out of our truck, we have to get into the streets. Let alone we're called to car accidents, and the risk of one of our providers being struck by a vehicle is incredibly high. And unfortunately, in some recent history, we've had that happen.
Yeah, last year.
Just last year. And unfortunately, that individual is doing well. But not only was it that individual case, but even those who went to render care to him were at risk because they weren't planning on being on the side of the road all of a sudden. They didn't have time to put on a bright vest like you may see police doing. So we wanted to take the decision out and let's just make this happen. And that's why we moved to this high vis is so we are seen, and it's on purpose. People often joke, I saw you coming from a mile away, and I say that's the point. That's what we want because we don't. That's a never event for us. We want to do everything we can to make sure our providers are as safe as possible. So hence we have our high visibility yellow.
Well, we appreciate what you both do. Shane, we appreciate the Shalom Project and what you and Adam are doing each and every day. Doc, thank you for taking care of the ER and keeping that going, as well as keeping people like Shane going.
Sure.
And thank you for answering a high call, because it is a calling. It's not a job. It's a calling, and we recognize that. Thank you for the partnership.
Thank you.
We'll continue to work as we want to see all of Marion County being served, and we're glad that we can play a small part in helping that, and we'll continue to demonstrate that we can make a difference together. Thanks.
Thank you.
We are so appreciative of that partnership with the IEMS and the time that they gave us to have a conversation.
Thank you, Jay. For 41 years, Shepherd Community has made a lasting difference in the lives of thousands and thousands of neighbors. Shepherd Team couldn't do that work without the support of donors, partners, and volunteers. To learn more about how you can help, please visit shepherdcommunity.org. Thank you for listening.
Thank you.